I'm here with Karen, and Karen is 1 week out from a facelift, a brow lift where we made an incision right at her hairline. We did a lower blepharoplasty on her, and then we did a rhinoplasty. Oh, and I'm sorry, with lip augmentation during her facelift. Karen, how are you feeling?
Feeling really good.
Feeling good. Tell me a little bit about recovery.
Recovery was good. You do definitely want somebody there to help you, especially with the showering twice a day. We also learned that press and seal Glad wrap type stuff works really well to put around your forehead to keep your nose cast dry if you're having a rhinoplasty.
Yeah.
I thought I had splints inside my nose, which you informed me I do not, but that's how much better my breathing has been.
Oh, good. Yeah, her and her husband were telling me that during the recovery they put some press and seal, like saran wrap right here, and draped it over her nose so that when she got in the shower it didn't get the cast wet, which is fantastic. The cast will tolerate a little bit of water, not a ton. If you get it really soaking wet, it wants to peel off, so it's a good way to kind of keep it dry. So yeah, I'm super excited for how she looks. I mean, she honestly didn't bruise. So this is 1 week. And we did a lot of work. I mean, this is brow lift. You can see her nose. Isn't that nose just so cute? Just that little lift to her nose. And then obviously what it did to the rest of her face, kind of lifting her cheeks, tightening up her jawline, really tightening up her neck. And she's only a week out, and already you can see just these beautiful changes that are taking place. So yeah, I'm super excited for her. But
And I have eyelids now.
I know. I haven't had those for a while, huh? Yeah. One of the things that Karen mentioned that I think is really helpful is that if you have a spouse or family member that can be there to kind of walk you through the whole recovery, it just makes all the difference in the world. We have patients that don't have a ton of support, and so they do care for themselves mostly, and they do fine, and everybody recovers okay. But it just makes a big difference, especially like emotionally, if you have somebody to kind of be your cheerleader and help you through and help with the cleanings and kind of all the areas that you can't really see. So yeah. I'm glad that your husband, in fact, we were wondering if he's out for hire, if anybody needs a good caregiver to take care of him during that week. So
it was really good. And we did do the cleanings and the medication exactly as scheduled.
Yeah.
And it is really nice to have somebody there to help you with that. But pain-wise, I would say it was very minimal. I think the worst part is just having to sit upright and sleep upright all day was the hardest part, actually.
Yeah, we like you staying upright just because it definitely helps just drain things. You know, when you lay flat, it swells more. And so I do like people to stay upright if they can. It's hard sometimes because your back starts hurting or you just aren't sleeping very well. And those are things that are kind of the trade-offs, but I do think it helps to speed the recovery along a little bit. The other thing that you mentioned that I think is helpful is just that despite like all the work that we did, it really doesn't hurt that much. You know, most people, did you have to take pain medication during your recovery at all?
I took half of a hydrocodone, and then the rest has just been over-the-counter Tylenol.
Yeah, that's amazing. So we give you, I think, like 10 pain tablets or something, just so you have it if you need it. Most people take very little or nothing, and half a pain tablet with rhinoplasty facelift combination. That's incredible. So.
So it's been really good.
Well, we're going to continue to follow you along as you recover. So we may take a couple pictures next week at the 2-week mark. 6 weeks will be kind of your final result, really. But I'm super, super happy with how you look now. Everything's looking amazing.
Thanks.
So.
Feel really good.